The word menopause is now starting to be incorporated into a lot of different skin routines and skin creams, partly as a marketing tool and partly trying to grab a certain demographic of the population. But I want to reinforce the point that menopause is not a skin size. It does not dictate your skin type, and it does not really dictate at all how your skin is going to behave compared to somebody else who is going through the menopause. As a consultant dermatologist, I've helped women of many transitions through their different periods of life as to what is going to be the best skincare routine for them, whether that be puberty, whether it's pregnancy, or whether it's menopause. And just because that is a state of change in the woman, it does not mean that the same changes happen to everybody. There are certain changes that are fixed to happen. There are falling estrogen levels. There can be a compromise in the skin barrier. But for some women, their skin might become more oilier, and for others, it might become drier. For some women, it might become more sensitive, and for other women, it might become more resistant. It's really true. One size does not fit all. Menopause is not a skin type or a skin size, and just one pot of a menopause moisturiser doesn't mean it's suitable for everyone who's going through the menopause. So the big question is, do you need a dedicated menopause skincare product? And the answer to that is definitely no. You do not need to change your skin routine specifically because you're going through the menopause. It might be something that has to be tweaked or changed a little bit, but again, I'll reiterate the point of one size does not fit all, and whatever your skin size is will actually help you then to decide what is the right routine if you did need to make a change. For example, it is true we start to lose a lot of collagen really through the first 3 to 5 years whenever we're going through that perimenopause period. But in truth, we've started to lose collagen from our 20s. So if the true gain of a menopause product was to help preserve as much collagen as possible, well, that routine really should have changed in our 20s and not necessarily just whenever we're in the perimenopausal and menopause period. So when it comes to a routine for perimenopause and menopause time, it's really about focusing on what your particular skin needs. And you can decide this and look at this yourself. Our skin sizing test can also be very helpful to help guide you to where the imbalances might lie within your skin. And then your skin routine needs to be unique. It needs to work for you. And the only way to work out if it's for you, if it's precise and it's personal. And then if there are specific skin concerns, so if you're wanting to address pigmentation, which sometimes can be worse for some people in menopause time, or the skin barrier, which again can be worse for some people, or a dramatic loss or change within the collagen levels, which can happen more for some people compared to others, well, then we can try and find exactly the right ingredients to target those things, because using the right ingredients at the right dose in a base that's comfortable for your skin is the most important thing. So like with everything, menopause is not a skin size. Your skin is unique to you, and the routine that you develop to help support your skin, again, also needs to be unique to you. We can help you with this by looking what your skin size is and looking at particular skin concerns, so it's completely targeted.